Hello, welcome back to My Conversation. Good morning, everybody. I'm Austin Reed. Thank you for joining us. Of course, My Conversation you see weekdays 10 to 10:30 right here on KAIL-TV after Access Hollywood Live. It's been an awesome show so far, but let's keep it going. My studio audience, we're packed today. Give it up for Dr. Maj from Visalia, a hair solutions and more specialist. Doctor, good to see you. Good to meet you. Thanks for coming in today.
Thank you.
We have a lot to talk about.
Yes.
First off, for my audience, how long have you been in the hair solutions world for?
Probably around 3-4 years. We started, I didn't start out trying to treat hair. I'm a family physician, so I started treating people with osteoarthritis of the knee, and we started doing platelet injections in there, and that started to work. And then I read a couple of papers about how PRP in Europe is used to regenerate hair. So I did some research, and we found a protocol that works with a couple of clinics in Europe and a couple of clinics up in Sacramento.
Now, you've been in Visalia for 13 years. How long have you had your clinic for now?
It'll be 4 years in May.
So on top of the hair solutions, like you said, you're also a family physician.
Correct.
So do you take patients, men, women, young, old?
I do.
Whole
So
variety?
I have kind of a holistic approach to medicine. So I try to harness the body's own regenerative properties to heal the body. I don't always put patients on medication either, so sometimes natural remedies work better or just as good, so I treat them that way too. I try to look at not just modern medicine in terms of how to treat a patient, but all the other things that are available. We do hypnotherapy in the office. I do some energy medicine. We do some Reiki. So it's kind of a holistic approach.
How many employees do you have? How many?
4.
4, okay. What are your hours? Are you Monday through Friday, or?
I'm there Monday through Friday from 8 to 5:30. Okay. I'm also open from 9 to 1 on Saturdays.
Oh, great. Okay, which is really nice for people that work during the week and can't get to the doctor, and they make excuses. I can never go.
I'm the only one there.
Are you really?
So
Okay.
I have maybe a nurse practitioner that comes 2 or 3 weekends out of the month so I can get a break. But other than that, it's I'm the only one there. I don't have any computers. It's one-on-one, just
Great.
like what we're doing now.
Just a conversation.
That's right.
All right, now what is this? What did you bring here?
So this is a microneedling pen that we use to stimulate the scalp once I've injected the scalp with platelets. We do this afterwards. It stimulates the scalp. You get more regeneration because it stimulates the stem cells even more, and you get better effect. So we use this. Sometimes we will. I also use the same instrument for doing microneedling of the face with platelets. So we do something like a vampire facelift. So we take the patient's blood, we concentrate the platelets kind of the same way that we would do for the hair, but we inject it under the skin, and we use this device, and it tightens the skin and gets rid of a lot of the lines. So usually 2 or 3 treatments. It pulls the skin. It's actually
So it's kind of like, so it's like a facelift.
Correct.
Okay.
Natural.
Does it hurt?
No, I usually do a
Like a
block.
numb?
Yeah,
Okay.
I block all the nerves in the face when I do the procedure, just as when I'm blocking the scalp when we do microneedling and when we do platelet injections.
And I know you brought some pictures today, some before and after. The differences that you see, I mean, talk about that.
So patients usually will need, depends on how much hair loss they've had. For men, usually most men and women will have pattern hair loss up here. Men usually will have a lot more, and usually they'll get bald up here first. And so patients that have very thinning hair that looks like they're almost bald, they would need multiple treatments, like 4, 5, 6 treatments. For people who have kind of a thinner hair, they may need 1 or 2 treatments. Usually at least 2 they would need. So we also have a procedure that I do that is called micronized fat. So we take some of the fat from the belly, and I collect about maybe 5 or 6 tablespoons of fat. It's kind of like a liposuction, but it's called microaspiration. So we take a little bit, so maybe about 6 or 7 tablespoons, and then we micronize it, we make it into smaller particles so it can fit through a needle. And then we stimulate, we activate that with platelets. So we mix the platelets and that, and then we inject that into the scalp. Now the micronized fat also has stem cells, so we're introducing the patient's own stem cells back into their scalp. And the effect of that is equivalent to about 5 to 6 PRP treatments. So sometimes patients that are really thinned out, that's probably a better solution. The great thing about PRP and stem cell injections into the scalp is that the hair grows in its natural shaft, so it looks natural. The problem with hair transplants is they take the hair follicles from the back of the head, and when they put it in, it's not growing in the right direction. So most people that you've seen that have had hair transplants, they look like they've had it because it doesn't look natural. With this, you can't actually tell. I mean, I've gotten treated myself twice.
Yeah, doctor, you brought a lot of pictures today. Let's do it. Let's take a look at the first one.
Okay. So here's a picture of the first picture. This is a male who came to see me, and as you can see, he's pretty bald. And I told him he needs about 5 treatments. He got 3 treatments, and this next picture is him 3 months after the treatment.
Wow.
And then the next picture, as you can see, he's got a lot more hair, and this is 6 months after that.
Woo! That's incredible.
We have also, this is as much of a problem in women as it is in men. So the next picture is a picture of a female. This lady had lost her hair. She's in her 20s. She had chemotherapy done, and she lost a lot of her hair because of that, and none of that hair came back, so she's pretty thinned out in the top. And then she had 2 treatments, and the next picture is 2 months after the 2 treatments, and then the picture after that is about 3 months after that, and the next picture is about
look at that difference.
6 months after. You can see a couple of different views of that.
That's incredible.
Yeah.
Wow.
And so if you can see how she started, and 3 months, 6 months, 9 months, and the 9 months, those are the 3 pictures that are all in different angles. You can see all that hair. She didn't have that if you compare it to the first picture.
What's the cost?
So if somebody's just getting a PRP treatment, the cost, the first treatment is $1,250. Second treatment is $950, and the third treatment is $850. And to the viewers of the show, we give $100 off for the first treatment. Now, if somebody needs multiple treatments, so the male that you saw needs multiple treatments, and sometimes it's not economical for a patient to come in 5 or 6 times. It comes out to be more expensive. So I have the other procedure, which is called a micronized fat stem cell procedure, and that is $3,500 for a treatment, and that's equivalent to 6 treatments. And when the patient comes back, so we treat them, we have them come back in about 6 weeks or so, and then I treat them again with platelets, and that's all included.
Beautiful. Phone number, website, how can people get in touch with you?
Phone number is 559-740-7989. We're located at 5109 West Goshen Avenue in Visalia. We're at the corner of Goshen and Acres Avenue. Website is www.majmedical.com or majmedicalclinic.com. And we're open 6 days a week.
My studio audience, give it up for the doctor in the house today. Hair Solutions Visalia. Thank you so much. Pleasure meeting you. You'll have to come back again, okay?
Absolutely.
All right. You're watching My Conversation. We'll be right back.